Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Non-medical switching is basically substituting one molecule for another for the sole purposes of an economic outcome that is favorable to the insurer or the pharmacy benefit management company, because none of these non-medical switchings take place because it's beneficial to the patient.
Welcome back to Healthcare Matters, the podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. As always, I'm joined by my partner in crime, Dr. Robert Popovian, joining us from Washington, D.C. He's a pharmacist, an economist, and chief science policy officer at the Global Healthy Living Foundation.
And across the country in Seattle, Washington, he's Connor Mertens, patient advocate and community outreach manager at the Global Healthy Living Foundation.
As we get into season 2 of this podcast, we'll be covering even more ground on what you need to know about healthcare economics and policies.
But before we get started, we want to be sure you take a listen to the other great podcasts on the Global Healthy Living Foundation podcast network.
Right, and one of those podcasts is The Health Advocates with Stephen Newmark and Zoe Rothblatt. They break down major health news of the week and help you make sense of all of it.
Connor, you and Zoe co-hosted Breaking Down Biosimilars. It really helps people, patients, understand the role of biosimilars, what they're about, what role they play in healthcare, and now in the future.
And you can find all of those at ghlf.org/listen. All right, let's take a look at a comment from one of our listeners. David writes, with all the news we hear about COVID, I thought the episode stating the successes and faults of the FDA was very important. Thanks for your review. And we invite you too to go to Apple Podcasts and write a positive review and leave an honest 5-star rating. And wherever you're listening, Apple, Spotify, or the rest, make sure to click that subscribe button so you'll never miss an episode. Imagine being on a prescription medication that's working for your chronic disease and then being forced by your insurance company to change for no medical reason at all. And now imagine that chronic disease is a mental health condition and think about the tremendous impact that can have on patients. So in this week's episode, we're going to go over the terminology, and then in next week's episode, we will learn how non-medical switching hurts patients who live with these mental health conditions.
We've covered this concept of non-medical switching in past episodes, but we're going to devote 2 more to dive deeper into this concept so we can learn ways to advocate against it and hear how it impacts people who suffer from mental health conditions.
And Robert, I'm sure that you have a lot to share about the topic, so let's dive in. Can you tell me what's non-medical switching?
To better understand what non-medical switching means for patients suffering with chronic medical conditions, we need to define what is generic substitution and what is therapeutic substitution.
Generic substitution is really simple. It's substituting a brand name medicine, generic drug, and generally they're medicines that have been approved by the FDA to be compatible, and they're significantly less expensive. And oftentimes a patient is switched from a brand name medicine to a generic medicine.
It's pretty important to make sure we distinguish substitution in this case versus switching, whereas when a patient goes through a generic substitution, the medications are going to continue to be as effective and they're going to continue to be what they're essentially taking before it. Is that right?
You're absolutely right. The medications have the same exact active ingredients. There's no difference. The second question is, what is therapeutic substitution and what is non-medical switching, which are slightly different topics. Therapeutic substitution is when a product gets substituted with another drug that are totally 2 different molecules. But therapeutic substitutions sometimes are clinically justified. And the reason they're clinically justified is because most of the time, therapeutic substitutions take place when pharmacy and therapeutic committees meet. These are committees made up of physicians, pharmacists. They sit around and they discuss whether or not they should carry one drug versus another. Hospitals have limited inventory space and they can't carry every single drug. So they have to make some judgment calls about which drugs they carry in the pharmacy versus the ones that they don't. And in that case, they get into a discussion about therapeutic substitution, which clinically is justified, but it is a discussion and a decision that's made between a pharmacist and a physician sitting in a committee and really dealing with clinical issues.
Okay, so that makes sense what generic substitutions and therapeutic substitutions are. And these may not, but potentially can impact patient care and the continuation of their care. But what makes it different from non-medical switching?
Well, non-medical switching is solely for the purposes of an entity like an insurer or a pharmacy benefit manager to make more money. And it's to the detriment of the patient. And that's the distinction. Non-medical switching is basically substituting one molecule for another for the sole purposes of an economic outcome that is favorable to the insurer or the pharmacy benefit management company, because we know that none of these non-medical switchings take place because it's beneficial to the patient. It really benefits the bottom line of this pharmacy benefit management companies and insurance companies. And it's really a significant burden on patients because these entities are not looking out for the betterment of the patient outcome, but rather to their bottom line. And patients are often not provided adequate notice of these changes, and physicians and providers are not provided the adequate notice of these changes that take place during a plan year.
Right. And like you're saying, folks can be taken off without any notice. In a similar vein, they're not given transparency. And that's a theme that we constantly bring up on this show is the need for more transparency in the healthcare system. And the folks can be taken off of their therapies and their drugs without any explanation. And folks are left scratching their heads, and oftentimes it's impacting their wallet, which I can't tell you how many times. It was last week I was speaking to a patient who mentioned that halfway through the year, their medication changed and they've been on it for about 4 or 5 years at this point. And it was really helping them. They'd tried a bunch of medications in the past that had negative side effects, and it really wasn't the right option for them. And they finally found a treatment that worked. And after 5 years, this formulary changed and they weren't going to stop taking their life-saving medications. And suddenly they were out of pocket costs in the thousands of dollars, where before it wasn't covered by their insurer. And so many detrimental impacts to these patients. They may be less likely to take the medication. They may be less likely to afford groceries or rent when they have to pay for life-saving medications. And those are really tough positions to put patients in when they inexplicably are kicked off of the coverage for a life-saving medication.
It's not just the exclusion of the drug from the formulary that then forces a physician or provider to change the therapy for the patient. The product can still be covered, but they can be moved to a different tier. So it increases the out-of-pocket cost, for example, for the patient. And they end up suffering and end up in a road that you just discussed, which is all of a sudden they can't afford the medicine. And even if they can afford it, they have to cut back in other areas, amenities that they need. And the other thing that this non-medical switching doesn't really take into consideration is that when you switch any patient from any therapy and you put them on a totally different molecule and force that because of financial gain for your institution, what you end up doing is that you're forcing the patient now to go back to the physician or the provider, get maybe additional tests. They have to go probably be adjusted on the new therapy if that therapy is good for them. And those are all burdens and costs that the patient incurs. And these pharmacy benefit management companies that make these decisions blindly, they really don't care about all the consequences that they're forcing upon patients. These patients end up not taking their medicines, or if they are taking their medicines, then they have to basically cut back on other amenities like we discussed.
This sounds like a pretty common theme that we hear, where the bottom line of a corporation is more important than the health of the folks that they're serving. It's really devastating. I do know that there are some states that see the harm in this and that have passed legislation.
Well, there are states, you're absolutely correct, that have passed legislation that forbids the pharmacy benefit management company or the insurer to make any kind of formulary changes during the plan year. So during that 1 year plan year that the patient is sort of enrolled in that plan. And those bills are really good legislative efforts that have been put in the books. Unfortunately, what happens is that they're not retrospective a lot of time, and they don't go back and fix problems that occurred before the passage of those legislations. There's still patients who are vulnerable to this type of activity, and it's important to note that those patients that have suffered in the past are not getting the remedy that they need through this type of legislation. The other thing that is important to note here is that patient protection through the Affordable Care Act prohibits certain health plans from making these mid-year sort of switches, these non-medical substitutions. Unfortunately, ACA requirements is neither complied nor regulated. And a lot of insurers basically thumb their nose and move on, and pharmacy management companies thumb their nose at ACA, Affordable Care Act, and they do whatever they want to do. And there's nobody trying to regulate or force them to comply with that.
This all sounds very concerning, Robert, but what are the numbers telling us of how much this impacts patients' lives?
Well, there's several studies that have been done. One that I often refer to is a study that was done in 2019 by Alliance for Patient Access that showed that nearly 60% of patients who experienced this non-medical switching reported a complication as a result of their medication change. That's significant. 6 out of 10 patients are ending up having some issues that they have to go back to their physicians, or God forbid, they have to be hospitalized because they stopped taking their medication was not the right medication, or they become non-adherent because they were forced to pay a higher out-of-pocket cost. It's important to know these things, and it is important to always remember that non-medical switching is all about reducing insurer and pharmacy benefit manager short-term costs to the detriment of the patient.
But as always, Robert, let's make sure you get the last word.
Well, the last word is that patients need to become very cognizant of that this is a possibility. This non-medical switching can happen to them. And it can happen to them unbeknownst to them because it can be done in a cloak and dagger manner by the pharmacy benefit management company during the plan year when they're enrolled in the plan and they've sort of signed up to something, and now it changes completely. It's like going and studying for an exam for chemistry, and all of a sudden you show up to the exam and the exam is about physics or algebra or economics. That's what patients need to be very cognizant of, that this can happen to them. And they need to be vigilant, and they need to work with their healthcare providers to make sure this does not happen to them. And they need to make sure that they appeal the processes to make sure that they're staying on the therapies that is the best therapy for them. Thank you for listening. We hope you guys all learned something from this episode. I have 2 requests. Number 1, please tune in for our second episode on non-medical switching, because we're going to focus on patients who suffer from mental health issues. And the second request I have from you is to go back and listen to season 1. We've done several episodes that sort of touched on this issue of non-medical switching, because it will give you better context of where we're going with this policy issue and how we can defeat the insurers and the pharmacy benefit managers and not allow them to take advantage of us as patients and as healthcare professionals. Please send your emails or audio clips to healthcarematters@ghlf.org. We would love to hear from you. We're always anticipating what you will say in our reviews.
Thanks again for listening to Healthcare Matters, a podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. As always, we invite you to go to Apple Podcasts and leave one of those awesome, honest 5-star ratings and write a positive review. We read them all, and they really inform our content here at Healthcare Matters. It's going to help people like you find people like us. And don't forget that wherever you're listening, Apple, Spotify, or the rest, click that subscribe button so you'll never miss an episode. He's Dr. Robert Popovian.
And he's Connor Mertens, and we'll see you all next episode.
This episode is made possible with support from AbbVie, sponsor of the Global Healthy Living Foundation.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.